Hi, my name is Kirsten Kurtz. I'm a registered dietitian here at Wooster Community Hospital, and today we will be talking about nutrition in cancer care. As registered dietitians, we play a vital role in your interdisciplinary team alongside your physicians, nurses, maybe speech or physical therapy, and other practitioners as well. Nutrition is a key component to your treatment plan, and today we'll talk a little bit about what nutrition looks like in cancer treatment before and after as well. A little quote to kick us off, "Let food be thy medicine and medicine be thy food," by Hippocrates. Disclaimer, this does not mean to stop taking your medications by any means. Still take those as prescribed. This just emphasizes the importance of food beyond taste and enjoyment and the role it can play not only in cancer care, but all different stages in life and different diagnoses with everyone anywhere. So we'll talk about kind of the basis of a healthy diet. A healthy diet does look a little different before treatment, during treatment, after treatment, and we'll talk about that as well. This is a picture of my plate, or the plate visual, which has kind of transformed from the food pyramid. It lists your 5 different food groups, which we want to incorporate into your diet, and it kind of shows how much of each meal or your plate should be made of each of these food groups, which is pretty proportional. Fruits and vegetables take up about half of your plate. These have lots of fiber, nutrients, and actually the colors that make up your different fruits and vegetables are phytonutrients, and they each have a different function. So it's important to get a wide variety of different colors of fruits and vegetables. Protein makes up about 1/4 of your plate. This is important in helping to maintain lean muscle mass, to prevent weight loss, and we'll talk a lot more about protein during treatment as well. Grains and starches make up about 1/4 of your plate. These are some of your carbohydrate foods, which are important for energy levels. And then we have dairy. Low-fat dairy products are a good option as able. Some protein and carbohydrates there as well. And then we also say plenty of fluids. Hydration is key, and we'll talk about why later as well. So here's an action plan for a healthy lifestyle in addition to a healthy diet. We want to achieve and maintain a healthy weight and be physically active as able. Drink alcohol in moderation if at all. Prepare and store food safely, which we'll get into more detail. Try a new fruit, veggie, maybe whole grain each time you go to the grocery store. And ask a registered dietitian to help you personalize a nutritious, balanced eating plan for your lifestyle and your current place in treatment. You can reach out for questions, or if you're interested in sitting down with us one-on-one, figuring out an eating plan, just ask for a referral from your physician, and we'll reach back out to you. Fresh, frozen, and canned foods are all great options to include in our diet. Keep in mind that meals don't need to be complicated in order to be nutritious. During cancer care, one of our biggest priorities as a dietitian is to make sure that patients are maintaining a stable weight. The reason being, cancer increases nutrient needs. And on top of that, treatment often causes symptoms that may decrease desire to eat or your ability to take in adequate nutrition to meet your basic nutrient needs. What can happen is we can experience too much weight loss. Too much weight loss can actually slow down or delay treatment if we're not meeting our basic needs. So we want to prevent that as much as we can. And that's what we're really going to dive into today. So as reference, what is a significant weight loss? When should we be concerned that one is losing too much weight? Here are some different markers that we look at as dietitians. Greater than 5% body weight in 1 month, greater than or equal to 7.5% body weight in 3 months, and then greater than or equal to 10% body weight in 6 months. And below these are some references of what would 10% weight loss look like. Any sort of significant involuntary weight loss can complicate treatment and recovery. So we really want to keep an eye on any weight changes and make sure we're addressing it with nutrition interventions. So now diving into some different challenges that you may experience with treatment. The first one that we're going to talk about is appetite. Some different things to try to navigate that is eating small, frequent meals and snacks every 1 to 2 hours, even if you're not hungry. Also avoiding liquids with meals, trying to move those maybe half an hour after the meal so you're not filling up with fluids and you're making room for nutritious foods. Be sure to keep high calorie, high protein ingredients on hand. Since you're not hungry, you're not eating as frequently or as much, we really want to focus on getting nutrient-dense foods, calorie-dense foods especially. Some examples might be butter, dry milk powder, protein powder, syrup, jams, jellies, nut butters, oils, anything to increase calories that we could also add to other items. Maybe setting a reminder or a timer to help remind you when it's time to eat. When you don't have an appetite, you're probably not thinking of food all the time or thinking, hey, I need to eat. So something might be helpful, or someone else to remind you could be helpful, because again, we want that small frequency of snacks and meals. High calorie snacks. Some examples might be trail mix, cheese and crackers, milkshakes, smoothies, things you can sneak some nut butters, protein powders, things into. Other things to help make sure that you're getting enough nutrients to prevent weight loss. One of the products that we carry here for oral nutrition supplements is Ensure. If you're ever admitted to the hospital, you may see Ensure Plus High Protein or Ensure Compact, but a product that you will see on the shelves at stores or on Amazon will often be Ensure Complete or Plus. You may also see Ensure Original or Ensure High Protein, which aren't bad products. The Ensure Complete or Plus just have a good offering of both calories and protein, which is important to help maintain weight. Boost Very High Calorie is a product that contains 530 calories and 22 grams of protein. So it is dense. So if you're really not able to get much in or keep much down, this is a good option that is calorie dense. Another product out there is Carnation Breakfast Essentials. This is a pretty common product in the stores that you can mix with milk or in smoothies or milkshakes that will just add some more nutrients and protein to your foods as well. Some other nutrition challenges with treatment include feeling full quickly. Here we want to consume smaller, more frequent meals and snacks, similarly with decreased appetite. With nausea and vomiting, we recommend eating bland foods such as dry toast, crackers, trying to avoid fatty and fried foods, as well as spicy and acidic foods. Sipping on cold or cool clear liquids. And if you don't have any mouth irritations, sometimes tart or sour foods can be kept down a little bit easier. With taste changes, it's good to try experimenting with different herbs and seasonings to try to change the flavor of things. Using plastic utensils if you're experiencing a metallic taste with normal silverware. Seasoning foods with tart flavors, such as citrus fruits. And then also adding sugar to salty foods or salt to sugary foods to kind of decrease sweetness or decrease saltiness. Also, serving foods cold or at room temperature can help as well. With dry mouth, sore mouth, tongue, or throat, if you're drinking calorie-dense high-protein liquids such as milk or oral nutrition supplements, make sure that you're drinking it through a straw to prevent exposure to the whole part of your mouth. Try ice pops or ice chips to soothe mouth and throat pain. Eat foods at room temperature if hot foods are causing irritation. Avoid citrus or spicy foods. And maybe try sucking on sugar-free mints or candies. Oral care is very important. We recommend brushing with soft bristles and rinsing your mouth with water or a baking soda mixture after eating. Other challenges may include difficulty chewing or swallowing. You could try cutting food into small pieces and eating frequently versus one large meal. Choosing soft foods. Avoid lying down for at least 30 to 45 minutes after eating or drinking. Using broths, juices, gravies, jellies, anything to help lubricate food and make swallowing easier. If you're having difficulty chewing or swallowing, you may be following with a speech therapist, and they may be recommending a modified diet consistency such as ground foods or pureed foods. Another challenge is diarrhea. Here we want to prevent dehydration. So we're replenishing any lost fluids with rehydration beverages that have lots of electrolytes, such as Gatorade, Powerade. There's also packets that Ensure and some other manufacturers produce that have salt and different electrolytes that you mix into water. Try to avoid caffeinated or carbonated beverages. Limit high fiber foods such as raw fruits and vegetables, whole grains, nuts, beans. But when it comes to constipation, we want to encourage those foods, those high fiber things such as fruits, vegetables, whole grains. But we also want to make sure that you're drinking plenty of fluids with those foods, at least 8 cups per day, or if not more, depending on your fiber intake. You may also be experiencing fatigue. Here we recommend stocking up on convenient foods that you like, maybe preparing foods, large portions of foods ahead of time to freeze or refrigerate for times when you're not feeling as well or up to preparing anything. And maybe consider asking friends or family for help with grocery shopping or cooking. Often nowadays, grocery and meal delivery services can be a big help as well. Changes in weight. Here we want to stick to an eating schedule to make sure you're eating routinely, even if you're not hungry, which we kind of already mentioned. Be sure to choose high calorie, high protein foods if you're experiencing weight loss. If you're experiencing weight gain, we want to watch portion sizes, choose healthier foods, and incorporate physical activity. With treatment, we want to make sure that you're still continuing to enjoy satisfying meals. Here are some little tips and tricks to try. Maybe you enjoy preparing your own food and you control what goes into it, or you'd rather have someone prepare it for you, kind of making that determination. Maybe eating meals with others versus alone. Eating small portions more often. I don't think we can emphasize that enough. Maybe trying new foods or taking advantage of when you feel energetic to go out somewhere for a meal, or eating meals with others, or preparing your own meal. And also saving that beverage for the end of the meal so you're not filling up and you're saving more room for nutritious foods. Some other tips and tricks, as I kind of mentioned, maybe trying a new location. If you want, maybe enjoy your favorite meal, or if you'd rather save it for after treatment, that works as well. Use fun dishes, glasses, silverware, things like that, just to mix it up a little bit. Now we're going to talk about food safety. With cancer treatment, you are often immunocompromised, so more at risk for foodborne illnesses, so food safety becomes that much more important. The 4 big concepts here are washing your hands and surfaces often, separating foods and preventing cross-contamination, cooking food thoroughly to proper temperatures, and refrigerating food promptly. Here we want to make sure you're washing hands and surfaces often. Bacteria can spread and get into cutting boards, utensils, countertops, food. So we really want to thoroughly wash things, especially fruits and vegetables, changing sponges, dish towels, wiping down surfaces with antibacterial wipes. We also want to separate and try to limit that cross-contamination. When handling raw meat, raw seafood, eggs, poultry, make sure to keep these away from ready-to-eat foods so there's no spreading of bacteria between the two. That means using separate cutting boards, using separate areas of the kitchen, and also keeping surfaces cleaned and hands washed. We also want to make sure that we're cooking foods thoroughly to proper temperatures. To ensure that's happening, using a food thermometer inserted into the center of foods to check when they're safely cooked according to USDA recommendations, which are poultry, leftovers, and casseroles cooked to at least 165 degrees, ground meats, egg dishes, and pork cooked to at least 160 degrees, and fish, steaks, and roasts cooked to at least 145 degrees. Lastly, we want to make sure that we're refrigerating or freezing food promptly after we've prepared them. Typically within 1 hour. If things need to cool down before going into the fridge or freezer, be sure to use several shallow containers to help it cool down quicker. Use a thermometer. Your refrigerator should consistently stay at 40 degrees or below, and your freezer should stay at 0 degrees or below. Thaw frozen meat in cold water in the refrigerator or microwave if you're planning to cook directly after, but do not leave it out on the kitchen counter. Not a safe way to thaw food. Read food product expiration dates and always look for signs of spoilage. If in doubt, throw it out. Lastly, we want to make sure that we're remembering the caregiver. Often we can get lost in making sure that those going through treatment are being fed and taken care of, and often we forget that the caregiver also needs to be taken care of their health mentally, physically, emotionally, spiritually. We also want to think about physical health, because if you are wearing yourself down and you're decreasing your own immune system, you're putting yourself at risk and then the patient going through treatment at risk as well. But mental and emotional health, just as important. Make sure that you're getting proper nutrition, rest, and relaxation yourself. Often we feel guilty considering our own needs, but consider what you would hope for if the situation were reversed. And what can be helpful sometimes is to lower or try to control expectations. Here on this next slide, we have listed some reliable sources of further information. If you're interested in looking into some of these topics a little deeper, we have the American Cancer Society, the Academy of Nutrition and Dietetics, National Cancer Institute, American Institute for Cancer Research, the Ohio State University, and here at Wooster Community Hospital. As I briefly mentioned before, if you're interested in talking to a dietitian, finding out some more information about nutrition in cancer prevention, treatment, following cancer, just talk to your oncology team, specifically your physician, about getting a referral. And then on this next slide, we have listed our contact information, either by email or phone, but we are located here in the main part of the Wooster Community Hospital. And here I have listed some resources used to create this presentation. Thank you so much for joining today. Reach out if you have any questions or concerns. But I hope you enjoyed this presentation and can put some of these recommendations into place to help prevent any weight changes.